40 years ago was a dark time in the story of the LGBTQ+ community. Prior to that time, lesbian, gay, bisexual, transgender, and queer people had shared the celebratory joy of gay liberation, the sexual revolution, and the start of widespread tolerance. These early victories, however, were by no means perfect. In January of 1977, the Human Rights Ordinance passed in Dade County, Florida, prohibiting discrimination based on sexual orientation. Less than 6 months later, it was repealed after facing an onslaught by an anti-gay rights campaign. The campaign decried the promiscuous behavior taking place in bathhouses across the country as immoral and a threat to the nation's children. That same year, when Harvey Milk was elected to San Francisco's Board of Supervisors, he became the first openly gay elected official in California. Tragically, he was assassinated just 11 months later. Every 2 steps forward for the community were hard-won and were almost always accompanied by 1 step back. It was then, when public perception had softened but was still fragile, that the people of the community were faced with what became the greatest threat to their lives that they had ever confronted. In late 1980 and early 1981, events began quietly and simultaneously unfolding. In Los Angeles, a handful of previously healthy gay men were diagnosed with pneumocystis, a fungal infection that had only been found in severely immunocompromised people. A seemingly separate group of young homosexual men were found to have a rare and generally benign skin cancer, Kaposi sarcoma. Independent of these cases, other men were being diagnosed with a severe immunodeficiency without any explanation as to its cause. In mid-1981, medical articles about these phenomena were beginning to get published. They designated the malady a gay pneumonia and gay cancer of unknown origin, from which the heterosexual public could feel protected. The general populace didn't much care about some obscure disease that was just affecting the gays. Meetings and discussions started to form in the cities most impacted by the mysterious outbreaks, such as San Francisco and New York. Gay activists and other prominent figures gathered to conceive ways to support research on, determine the cause of, and put a stop to the affliction. One of the largest obstacles was funding for these efforts. Without the support and purse strings of the public, little progress could be made. Treatments in these early days were based on prior understanding of the infections physicians were seeing, but explanation of the patient's compromised immune systems eluded researchers, and so, unable to correct the issue at its source, these traditional treatments continued to ultimately fail. The number of people who had been diagnosed easily passed 300 before the end of 1981, and going into 1982, gay men started to realize that a friend, or at least a friend of a friend, someone fairly close to each of them, had been diagnosed. But for all the disruption the disease was causing, it still didn't have a name. The medical community had begun to refer to the diagnosis as gay-related immune deficiency, or GRID. This new name wouldn't last, though, as new patients, hemophiliacs, had been identified as having the same signs of immunocompromise. The consequences of the misleading moniker would last far longer than the name, which was officially changed to Acquired Immune Deficiency Syndrome, or AIDS. Sadly, the name GRID would negatively impact LGBTQ+ rights, as well as the medical and public responses to the epidemic. Though the syndrome now had a name, the cause was still unknown. Physicians and researchers struggled to get the financial backing they needed to try to identify a causative agent. A push to provide funds for research didn't even make it to Congress, and disgracefully inadequate funding persisted for years. At this point, animosity between the world of healthcare and the gay community was fiery. Gay men on both coasts were demanding that some kind of progress be made. They and their friends were dying. As a new year opened on the world, the first dedicated outpatient AIDS clinic opened in San Francisco General Hospital. Later that year, they would also open the first inpatient AIDS clinic. Debates on how best to protect the blood supply were heated. The blood product industry leaders, not wanting to acknowledge the possibility of transmission through transfusion, refused to come to an agreement on how to mitigate the spread. And so rather than enacting any new measures, nothing was done. The first female cases were discovered that year. AIDS wasn't just a gay disease, but, in fact, could affect anyone. Not 5 months later, the first AIDS discrimination lawsuit was filed. The board of directors of a building in Greenwich Village tried to evict a physician from his office space. He was using it as a practice to treat patients with AIDS, which made the other tenants uncomfortable. Lambda Legal was a civil rights organization focused on the LGBTQ+ community as well as people with AIDS. They jointly filed a lawsuit with New York City Attorney General at the time, Robert Abrams. The charge eventually resulted in an award to the doctor of $10,000 and a new lease. The plight of people affected by AIDS was becoming more visible in the public eye. At the same time, the microscopic culprit sparking the sickness was finally becoming visible to scientists. In May, researchers at the Pasteur Institute in Paris, France, announced the discovery of a retrovirus they eventually identified as lymphadenopathy-associated virus, or LAV, which they believed to be the cause of AIDS. Doctors Françoise Barré-Sinoussi and Luc Montagnier would one day share a Nobel Prize in 2008 for this discovery. Nearly a year later, in 1984, the National Cancer Institute made a similar announcement and designated the virus Human T-cell leukemia virus 3, or HTLV3, though it was correctly speculated by some at the HHS that the two isolated viruses would ultimately prove to be the same virus. The National Cancer Institute added to the announcement of the discovery, revealing that they had also developed a diagnostic blood test to identify the virus. A debate between the Pasteur Institute and the NCI over the original discovery of the virus would endure for years, as would a dispute over the original patent for the blood test. But at long last, there was a smoking gun. Blood could finally be tested, and research for treatment could truly begin.